You are watching or listening to Purham and Associates. For more information, go to rpurham.com or follow me on all social media platforms and subscribe at RPURHAM. See you over there. Hey, good evening to you all. Welcome to Permanent Associates. I'm your host, Randy Purham. Hey, I hope you all are having a fantastic week so far, and y'all are staying out of trouble. I can't say that for some people out there. You know, a lot of craziness going on this week. Students walking out of school protesting. Don't even know what they're protesting about. You know, they only protest what they're being told to protest about. But we're not gonna get into that tonight. We're not. We got some other stuff to talk about. We got Andreas Sanchez back with us this week. He was here last week and 2 weeks prior to that, talking about finances and healthcare and all that good stuff. We promised you that we was going to come back and pick up on this topic because it is a hot button issue right now in our country, and that is affordability. And I also got Tiffani Jones with us tonight. And folks, we're gonna get it in, and I'm gonna go ahead and bring in the panel. We're not gonna do any introductions because y'all already know who he is. And if you don't know who he is, you just go back to last week's show to see. This is how I promote stuff. You can go back to last week's show and catch him and catch up with the bio and all that good stuff. Andreas, welcome back, sir. Tiffani, welcome.
And Thank you
for having me, guys.
Yes, absolutely. I'm out of transparency, folks. We was having a little technical issues getting on. I said, Andreas, the reason why you having technical issues because you dropped so much fire last week that China and the government don't want you talking anymore. They don't want you talking to the American people and educating them. That's what happened. But
that's what it looks like.
Yeah, it happens, folks. It happens. You know, we get censored around here. You know, we get wiretapped and everything. So I'm trying to get rid of the Patriot Act. But anyways, folks, y'all look that up on your own. How y'all doing tonight?
Oh, great.
We're doing great.
Awesome. So,
well, we won't complain about our weather, though. Our weather is like 75 here today, and I really don't want to say that because other people in other parts of the country are probably suffering a little bit. So,
yeah,
I know
the East Coast is.
We're having Florida's weather today.
Yeah, you know, it was actually pretty nice weather today here. It was about 70s, upper 60s, 70s window. So I'm not complaining. That's like the perfect weather for me, and so I'm good with that. It was cold last week though. We caught some freezing rain, iced over a little bit, but we got through it. You know, it was fine. I was okay. I'm from Chicago, so yeah, walk in the park. But folks, let's get into tonight's discussion. We're talking about Medicaid or Medicare. Which one? Well, we can talk about both actually, because the American people need to know the difference between the two. And Andreas, you can open us up with defining what the two are. You know, Medicaid and Medicare, because I know people get confused. Sure. I get confused with this shit. So
right?
Yeah, absolutely. So let's start with Medicaid, right? Medicaid is welfare. It's run by each state. It's funded by the state mostly, and each state has its own rules and regulations. So the best definition is welfare. Medicaid is for welfare purposes. So they have limitation on income and also coverage, right? It's for the needy, right? Whether it's due to medical conditions or for income related purposes. It's an extra help.
Mm.
Then we have Medicare. Medicare is the federal plan. It's not funded by the state, it's 100% funded by the federal government. So anyone that, I mean, it was created in 1965. Pretty much what it entitles is that if you work 40 quarters or 10 years, right, in the country, you are entitled to Medicare. But Medicare has parts A, B, C, D. It's like also a whole soup of alphabets that comes with. But pretty much when we working, we contribute to Medicare. That Medicare is Part A, like an apple, and that part of Medicare is designed for hospitalizations when you turn 65. So to be clear, you're entitled to Medicare at age 65, regardless of income. You're entitled to it. You can receive Medicare before 65 due to disability. So it's something else that triggers if someone is disabled, they can get into Medicare. And pretty much to receive disability, you have to prove that within 2 years, pretty much you cannot work or perform those activities and you're fully disabled. So Medicare kicks in, right? When people turn 65, which the majority of people receive Medicare at that age, so Medicare Part A, you pay your entire life, which is great. Then it comes Medicare Part B, like boy, that you have the option to take, right? It's optional, but it's not optional. I'll explain that later on, but pretty much it's optional. You pay a monthly payment for that. The monthly payment is, in 2026, is $205.56, I believe, per month. That usually gets deducted from your Social Security check if you are collecting Social Security. If you're not collecting yet, you have to pay out of your pocket. And that will cover hospitals, pretty much A, cover hospitals and skilled facilities. And Part B is for doctor services and equipment. So Medicare Part A, think about you going to a hospital and you're on a bed on a hospital. That's what Medicare Part A does. Part B is the doctor or the nurse that knocks or give you a service. So those are the two different types of billing. Now, that doesn't give you access to prescription drugs. Medication is a separate entity, and we will talk a little bit about that. So I'm just going to be quiet and ask. Do you have questions?
I do.
Well, that was a good one, because I was going to start out with the same thing, saying, in terms of 2026, now there are changes in the Medicare costs and what they are, and then go through Part A, and have you take us through all those parts. So that was great. So I do have a question, though, in Part D, if we want to get to that, and now and not later.
I want Part A. I got a question about Part A.
Okay.
Part A,
sure.
And Part B. Part B. You said you're paying $200 something, out of that, and if you're drawing Social Security, it will come out of that. If you're not at the Social Security age yet if you're not at the age to draw Social Security, then you're just paying that out of pocket. Now, for the American person, because for the American people who say never worked a job in their life, and they just moseyed on through life. They may be a rich kid, type of deal or whatnot. Do they qualify for Medicare A or B when they do hit that age?
Okay, so let me rephrase this, because you have a question that has like it's a two-edge. So when you say they're not working for a medical condition that you cannot work, or they're not working because what?
They just never worked. They never held a job. Not because of medical or anything. It was just like, I grew up in a rich household. I didn't have to work. I'm a spoiled rich kid. I'm a spoiled brat. So, but now that I'm old, I want to apply for Medicare. Would they qualify?
All right. Yeah, absolutely. They will qualify because in that specific scenario, right, that individual, he might not have held a job, but he paid taxes. Because it's based on your taxes. So you have to declare 10 years of income taxes, right? Or 40 quarters to be entitled to
Mm-hmm.
Medicare. Now, if you work cash your entire life and you never declare taxes, guess what? You don't qualify for it. Now, you
Interesting.
can purchase it. You can purchase it,
Yeah.
right?
Yeah.
And it will
Mm-hmm.
cost, I don't know, a grand a month, around $900 a month, just for Part A.
Okay.
Mm.
So,
Let's see.
so I don't know if that answered your question.
Yes, you did.
It's just based on like what you contribute. It doesn't matter if somebody is rich or poor, as long as they have their quarters of contributions,
Mm-hmm. Then they're entitled
they're
Mm-hmm.
to it.
they're entitled to Part A of Medicare.
Gotcha.
Mm-hmm.
Now the Medicaid side of the house, this is for the welfare class. This is for people
Correct.
who did not work or had, whatever reasons, but they're in the welfare system for whatever reason. They're covered through Medicaid,
The
yeah,
state.
the state version. Now let's
Correct.
ask the $1 million question that was coming up just during the whole purpose of the government shutdown was behind healthcare and that
Mm-hmm.
funding to illegal immigrants, not funding, but illegal immigrants getting healthcare.
Right.
The main question was, can illegal immigrants get Medicaid? And the answer was universally no, they don't qualify. But then it was like,
Mm-hmm.
but because it's going through the state, like you mentioned, the state will still cover them through hospital visits through the emergency room, and they would get
Mm-hmm.
that follow-on care and
Yes.
everything else. So there's a caveat there. Can you
Mm-hmm.
walk us through how the state funding of that works and how that is generated?
Yeah, I mean it's a little more complex.
I
That
know.
it's not like
I know it's
black and white
complex.
per se, right? It's complex. So,
Right.
if somebody's on Medicaid, they need to have a Social Security number for the most part, right? Something that they're declaring,
Mm-hmm.
because it's coming from taxpayer money. However, Medicaid and receiving assistance on some hospitals, like something called charity care, it's different. So,
Mm.
people who have no documents per se, there are certain hospitals, certain areas where they will receive charity care. Let's say I go to the hospital to receive charity care. I can be seen by a doctor at the hospital, receive treatment. I don't have the means to pay, the funds to pay, so the hospital would absorb that cost.
Hmm.
So it's not directly Medicaid, it's indirectly because it's being absorbed by the hospital per se. And this hospital
Mm-hmm.
receives some funds from the state, also receives some funds for the federal government. Different pots come in and they're able to take care of people, right?
Yep.
Whether they have documents or non-documented. One of the big benefits, I mean, how I explain this? In America, right? If somebody gets into a hospital, they get treated. They don't get
Mm-hmm.
asked what insurance they have.
Right.
Okay,
That's
and that
right.
is a blessing. It's not a curse.
Mm-hmm.
That is how we see things. It's a blessing. Because I can tell you by experience, in other countries, if you get into the hospital, you don't have a way to pay. They let you there. They let you die on the door.
Hmm.
It doesn't matter
Mm.
That's true.
what your
I
name
have seen
is.
that. Yep, that's
If you
true.
don't have a form of payment, they put you in a bed in the corner and they let you die. I mean, they're not gonna serve you.
Yep.
That's how it
Mm.
works. So
They roll you down to the
you know,
morgue and call your
we got
family and tell you
we
come
gotta
identify
take
you.
one for the other.
Yep.
Correct, exactly.
I
So,
I agree.
that being said, I'm sorry. What are you saying, Randy?
No. I agree with you. No, I was just saying I
Oh,
agree.
Mm-hmm.
okay. So Medicaid is people who have low income or has low income and might have some health conditions, right? So, for example, there are temporary Medicaids statuses. For example, let's say a woman gets pregnant, right, and she's on a low
Mm-hmm.
income. She can get temporary Medicaid to cover those expenses while she gets back to work. And I think it serves a purpose, right, for that family that is growing on a certain point that they don't might have the resources, right? They might not have
Mm-hmm.
$20,000 to pay for labor. So it's
Mm-hmm.
there for a group, for the society in general, right? Does it get abused? Yeah. I mean, right now I was just reading um, something that just happened in California. They this Medicare claims. Okay, Medicare probably goes to the most fraud possible. It's insane.
Yes,
So this
that's so
doctor, one doctor, $120 million in income he got from Medicare.
true.
One doctor.
Mm-hmm.
He was more than all the claims in Florida or the state of New York.
Mm-hmm.
One doctor. He claimed that he saw 1,900 patients. We know that is
Mm-hmm.
not possible, right? So there is a lot of fraud.
No,
And it's not nothing
absolutely.
different.
Well, Andreas, wait a minute now.
Yeah,
Wait a minute. Wait
yeah.
a minute. I'm gonna push back. I'm gonna push back here today,
Go ahead.
folks. No,
Go
I
ahead.
call BS. No, I'm gonna
No.
I'm gonna defend the doctors today. You can see 1,900 patients on paper. You can just look and say, "Yep, I said okay, check. Yep, yeah, they had that." Yes,
Right?
yeah,
Okay.
that's how they did it. That's how they don't tell you. They don't tell you how they
Yeah.
seen them. They just tell you they seen them.
Yeah.
So yes, that's how they did it.
Well, too,
Correct, right?
Medicare, right. And also, Medicare offers certain things, as I would say, as certain technologies come out, and it's higher than the average in the beginning, and then it kind of settles to a more what should I say, average or a cost or something like that, because sometimes Medicare does do that. Though they offer, like for stem cell, they might offer X amount of dollars, and then before they go into lobbying for the cost of it, people get into it for different things, for different reasons, and then they'll come back and they'll lower the cost, and then that prevents the fraud. But in the beginning, you can't. It's so hard to do until you regulate that. And so
Exactly.
I do understand that. So, but
Yeah.
yeah, Medicare is I think it's a great program otherwise, right?
Medicare is a great program. It's a great provider. In fact, is the biggest healthcare provider in the nation. No insurance
Mm,
company comes to like 20-30% of what Medicare pays. That being
mm-hmm,
said, right, they're the
mm-hmm.
big payer in the country, right?
Mm,
Doctors, hospitals, they all make money out of Medicare.
yeah.
That's the
Yes.
big daddy. So they're the big providers. Now, they're horrible administrators.
Oh, they are. I
They,
know. I know. I've had friends that are doctors who tell me that they are.
Yeah. Now
correct.
my question.
So, yeah,
No, I was going to say on that the administrative portion of Medicare, being as horrible as it is across the nation, with the fraud that we just talked about, or the potentials of fraud and everything else. If the United States was to say, "Hey, effective March 1st, because we're on 4th February now, effective March 1st, we're getting rid of Medicare. We're getting rid of all of that. Medicaid and Medicare is out the window. It's done. Figured it out, folks." what
Oh my goodness.
what calamity do you see? What would be the alternative for people to do? I have an approach for it, but I want to get your thoughts on that.
well, I don't think it's happening, right?
Right. It
I
won't
don't think
happen,
that's
right?
happening.
We're like, oh, it never happened.
Uh, it's I think it's gonna be reformed. It's gonna become more transparent. It
Mm-hmm.
needs to become more transparent because it's being abused. Right, it's a lot of
Mm-hmm.
waste and abuse that has been happening for years.
Yeah.
This is not something new. I mean, I could tell you, 15 years ago, I remember around in Florida, there were around like 120 doctors that went to jail.
Mm-hmm.
They
Oh,
were using
wow.
Yeah.
claims. They were using claims, right? And they were using doctors' tax IDs that they were already dead.
Exactly. Yep. I was just a bit.
Oh my
So
goodness. Yeah.
I'm Dr. Andres, right? I died 10 years ago, and I was part of practice with Ryan and Tiffani. And Tiffany will keep sending claims using my name and my tax ID for years. I was dead.
Yeah.
So this
And the
fraud, waste, and abuse
alternative.
has been happening for years.
And the
And it's a difference
alternative to
between
that,
fraud. Yeah.
the
I,
alternative
I
to that
mean, it's
was that,
transparent.
yeah, I was
Go
gonna
ahead.
say the other thing that I seen happen. It was a big story on this. But I want to say it was on 60 Minutes. It was some years back where doctors were still submitting claims on patients that they had already killed, like they was already dead. And so
Oh, wow.
they were
Yeah.
still showing that they were
Yeah.
doing services and stuff for them. So yes, you're absolutely
Hmm.
right. It's
Hmm.
criminal. I was like, wow, that is
Correct.
so crazy. So
Correct.
yes,
No,
continue.
it
I'm
is
sorry.
So,
criminal.
so Medicare is one of those entities, right, that it was subject to this waste and abuse, right, over the years.
Hmm.
Not different than Social Security, not different than what we saw at the beginning of last year when Dodge was uncovering all these people receiving Social Security paychecks and they were dead, right? It was a lot of stuff that some of might be fraud, sure. Some are is just oversight and it's just waste, right? Because nobody is like
Yeah.
keeping up on what the claim says. So having a system that becomes more transparent and having entities that, I mean, if if you're the CEO of a company and you have so much waste and abuse, you get fired,
Hmm.
right? But the government is not going to fire themselves,
Exactly.
No.
right?
Exactly.
So point being, that's why some of these Medicare Advantage plans become more attractive, even for the corporations, because the corporations, the institutions are managing that risk. Medicare is not managing that risk so much,
Right.
you know.
So,
So
um, let's talk about the supplemental coverage, but people get mixed up too and a little confused with the Medicare Advantage part, right? So most people
right,
believe that it provides benefits beyond the typical Medicare. So explain how
yep,
supplemental medical insurances work, because I think that's
okay.
something that
So
people probably want to know.
all right, so traditional Medicare, right, which is the
Hmm.
red and blue card, has Part A and Part B in it, where it explains that you pay for Part B a month, and Part A you don't pay because you pay your entire life. Now, Part D, which is the prescription drugs, is a separate entity, right?
Right.
That you pay a premium for it, and that gives you access to the pharmacy. So with traditional Medicare, you have A, B, and C, A, B, and D. Those are the three sections. Okay. Now there is another section called Medicare Advantage size, which is Part C, and I'm going to touch that in a second. But Medicare itself, when you have Medicare alone, there is coinsurance and deductibles that you might be exposed to. Okay. So, for example, if you go to the hospital with Medicare alone, right? Very easily you can pay $1,700 just to walk into the hospital. Whether you stay 1 day or 60 days, that's your deductible.
Mm.
And you're gonna pay some coinsurance with Medicare. Medicare is great. The issue is that that coinsurance doesn't have a
Hmm.
limit. It can be $20, it can be $200,000, right?
Mm.
It has no limit. Okay, so that's why Medicare, the federal government, developed what is called Medicare supplements. Medicare supplements work directly with original Medicare. So Medicare is the primary, a supplement is the secondary, and they just pay everything that Medicare left on the table. So when
Mm.
somebody has original Medicare and a Medicare supplement, think about this. You can go to any doctor, any hospital, any specialist, right? Any skill
Hmm.
facility in the nation, because Medicare has no network. You just go anywhere you want, right? As long as they accept Medicare. That's the rule.
Exactly.
So the supplement just fill those gaps. And with those two, you can go anywhere and you have full coverage. Now,
Mm.
this supplement has a premium.
Yeah,
So original
exactly.
Medicare is like a car. You pay for what
Hmm.
you get. You want more service, you want more options, you want more flexibility. Yeah, it's available. It has a premium.
Hmm.
That's
Now,
original Medicare. Yes, sir.
Question. Thank you for that explanation because, like Tiffany said, a lot of people get confused about the supplemental portions of it.
Hmm.
What if you
Mm-hmm.
have you're 9,000 years old, you're on Medicaid, Medicare, you got your supplements, but you also have private insurance, private health insurance. Can you blend all of that in together, or will a hospital or a clinic say, nope, you can only do one or the other? Can you explain the aspects of private health insurance coupled with that?
But what you saying, private health insurance to like employer that
It could
you
be,
paying
yeah.
for private health insurance?
Yeah, I get offers all the time, through like these different organizations that I'm a part of. They say, "Hey, you can get health insurance with us if you want." And I'm like, "I already got health insurance." So yeah, so it could be through an employer or through something else. It, but it's private
All
insurance.
right.
It's not under the Medicare apparatus.
So that's actually a good question. So what happens is this: when you have Medicare, then you don't need that private insurance. That private insurance is in place for us because we're not entitled to Medicare. The younger
Thank you.
population,
Mm-hmm.
Thank you.
anyone under 65 need that.
Yeah.
Now, let's say I've been working for a corporation XYZ for all these years, and I'm having my healthcare paid by the company. And let's say it costs me $100 a month per se. I have very good health
Mm-hmm.
benefits.
Hmm.
Great. I turn 65. Now, I have the option to pick Medicare. Because again, remember when I say it's optional?
Hmm.
So Part A
Mm-hmm.
is gonna get issued automatically no matter what because I turned 65. That's
Right.
it. It just gets issued.
Mm-hmm.
Now, Part B is optional, which I can start paying for it. However, if I have coverage that is considered to be acceptable by Medicare, right?
Mm-hmm.
Then I don't have to pick Part B.
Mm.
I will
Oh.
have only my work insurance,
Yeah.
and it's fine. Bingo. Now, the moment
Mm-hmm.
I stop working, this is one of the biggest things. The moment let's say I work until age 70 because I wanted to max out my salary. At age 70, I stop working. Now, my work insurance is going to stop, right? It's going to be done
Right.
per se.
Hmm.
So, in that case, I have 8 months from the moment I retire. Well, 3 months from the moment I retire, but 8 months total to avoid penalties to pick up a Medicare supplement
Mm.
and to pick up Part B, Pilas and Boy,
Mm-hmm.
and I won't get penalized. I have to fill out a form from my employer and from Medicare, send it to Medicare, right? That
Mm-hmm.
shows that I did have credible coverage. So I will avoid the
Mm-hmm.
penalty because there is a
Mm-hmm.
penalty if you did not take Part B when you turn 65. And that penalty is 10% for every year
Year
that
that
I
you're not
did
on it.
not enroll. So in that case, let's say that I turn 65, I retire at 70, and I do my paperwork on time, then I get activated my Medicare Part B. I can get a Medicare supplement, and I will be fully covered, no questions, no penalties. Now,
Mm.
let's say that I get to age 70, I retire, and I go on vacations for a year. I go around the world. I come back and say, well, now I need Medicare because I was away, right? Or whatever.
Right.
I
Right.
forgot. Like most people know, I forgot or I did not know. So now I need Medicare Part B. I'm going to enroll. Well, my open enrollment already closed. Now I'm going to pay a penalty.
Oh.
A
Mm.
penalty in this
Mm-hmm.
case, because 5 years later, is 50%. So I'm going to pay
Mm.
50% more on my premium for the rest of my life.
Yep.
Oh.
It's not for a year, it's forever.
Yep. And a question on that.
Yeah.
So this is tied to the Affordable Care Act. The penalty.
No,
The penalty
Medicare has
phase.
been in place for a long time. Medicare
Right.
has been in place for like way longer than that.
Okay. So
The
for
Affordable
the
Care Act is more for like us, like the younger generations,
yes.
right? That just
So
uses those funds through that.
Gotcha. So the penalty piece has always existed versus the
Well, since 1965,
versus
1965
okay.
when Medicare was created.
Gotcha. Okay, so
Mm-hmm.
this is not tied to the penalties under the Affordable Care Act, which has similar repercussions.
Yeah, it has similar repercussions, but it's a different animal. It's a
Okay,
different
gotcha,
budget. Even
gotcha.
though they took money from A to give to B, and C, they pass the money around. But
Yeah,
Medicare
yeah.
is a different pot per
Gotcha.
se,
Okay,
and
I
it's
just want to
protected.
I want to
Yeah, that's good.
clarify that. I want to clarify that. Now
Correct.
on
Now,
that, go ahead. I'll wait.
so Randy, let's say that I still have my covered insurance. Let's say a part of my retirement package
Yeah.
is that the company is gonna pay for my healthcare. That's great. Well, what's going to happen is depending on how many employees are on that group insurance, so that group insurance is going to work my as my supplement. So Medicare will be my primary, they will be my supplement. If the company is too big, then my insurance will be the primary and Medicare becomes my secondary. So it depends on how many employees are involved on that group insurance as well.
Okay.
Mm-hmm. I do know that in California, they just passed a law talking about insurance for, when you have a 401k and their contributions that your employer makes to it as well as yourself, or it was that the employee made the contributions and then you could, as the employer, match that. But I believe that there is a law and legislation that just passed in California that stipulated that the employer has to match that retirement fund. Like they have to match dollar per dollar for that retirement fund. So that's kind of causing a little chaos and disruption with people who want to work and the employer. So the employee and the employer. I think that's why people. Last week I think Amazon laid off like 19,000 people, but you have to understand what part of the states that they did that. So let's say that was in California, then those 19,000 people were, because they don't want to put more costs into someone's retirement fund when they're paying so much for an employee as it is. So that has,
Correct.
those employers kind of rethinking what they want to do in terms of their retirement funds. But I don't know what's going on in Nevada. Is that the same? Have you heard about that in Nevada
I
as
mean,
well?
it's not mandatory. It's optional for 401ks to match because at the end, what is the matching on the 401k is an incentive, right? How do I retain my good people, my employees, right? Well, if I'm contributing, it's one of the enticements to keep the employer. I give health benefits. It's an enticement. I mean, for a corporation, it costs them around $30,000 to $36,000 a year
Right.
per employee to offer healthcare.
Mm-hmm.
It's a
Right.
lot of money, right?
I
So,
know. People don't know
and
that.
on top of that, yes, it's not free.
Yeah.
It costs a lot of
No.
money. So, and the other part is the like you saying the matching, right? So they can match 3, 6%. Some like energy companies, I see some oil companies they offer up to 10%. That's just unheard of, but it's an incentive because the pension system switch. Okay, back on the days, you remember your grandpa, your grandma, right? They work in one place, and the longer they stay, the more money they make, right? That was the story.
Right.
And they will get a
Mm-hmm.
pension. It was a
Mm-hmm.
defined, it's called defined benefit plan. So
Mm-hmm.
who was taking the risk? The
Mm-hmm.
company, because they were
Yes,
responsible
exactly.
for the pension perform. They had to cover all the
Mm-hmm.
expenses. And you as an
Mm-hmm.
employee, the your reward was the longer that I stay, right? I'm gonna get a pension from them, and they have to manage it for
Mm-hmm.
me.
Yep.
So
Right.
with the RISA, that changed, that flip. So it went from defined benefit to defined contribution. So slowly, a lot of plans were start shifting to that. So now, for example, Tiffany, you and I are workers, right? Let's say you're my employer, and you offer me a 401k. I can contribute before taxes from my paycheck into this account that is for me, it's for my retirement. Now invested into it, right? In addition to that, you're gonna do a match for me. So it's called free money, guys. If you're not taking that match, that's crazy.
Yep.
But you adding that contribution, it's an incentive for me to stay with you, correct? Now we are
Right.
vested together into this account that you put in for my benefit. Now you subcontract a company to manage that. You know, there's a lot of warehouse corporations that do that as well. But now who is in charge of the performance?
Exactly.
Not Tiffany anymore. I'm the one who needs to see how I pick my investments. Not my employer. They offer me
Right.
the menu, and I have to pick and choose from what is there, right? And take it for granted. Grow it. So now responsibility falls on the employee to match or to watch over that performance. But again, it becomes to that enticement of capitalism. The moment that you start forcing institutions, where things gonna happen? They
Right.
try to get the most, or they're gonna try to get the least amount.
Exactly.
I would speak to that. I would speak to that briefly because
Yeah.
in the military back when I was serving, we had what was called the Thrift Savings Plan or the TSP, and that
Yes.
that was introduced my mid career. Like I was already in like 10 years at this point, but that was introduced as a 401k version of our retirement plan. And so when we got that, you had what was it was four different funds you could choose from. Just like you say, you kind of like was in control of how much you put in, and the military would match. I would say at the time it was up to 4% or something like that, 5%. But then a few years later they cycled around and they added in what was called the life cycle funds, and it was like L10, L20, L30, L40, and it was an L50, and so that's when it got really crazy for soldiers to try to figure out like what does this mean. And it was like the more money you put in it, the more money you put in it, the more you have in retirement. And so you had soldiers that literally was dropping their entire paycheck into and they was eating, they was living on ramen noodles and solar panels. I'm like, and so that became problematic though. It was like you can't do that. You can't. So they put a cap as to how much you can invest, you can put into it, because it became an issue. It was like, okay, we understand that you're trying to save for your future, but you also have to live, type of thing. So to Andreas' point,
Right.
yes, that it is a personal investment and a personal watch on as to how you handle that. My question to you,
Correct.
sir. My question to you, sir, is going back to Tiffany's point about the layoffs of the 19,000 Amazon employees. What type of healthcare system would they fall under if they were to say they was getting employee benefits and getting through the employer? Now they no longer get that because they got laid off. Where do this class of people go to now?
So now they fall into what is called COBRA. So COBRA gives them the option to keep their healthcare benefits from their employee for up to 18 months. But but they also come with a payment. They're like, okay, this is what your employer was paying every month. If you decide to continue your healthcare coverage, you can pay it. If you decide to pay it, send the bill, send the payment, right? Otherwise, the payment gets terminated. The
Well,
insurance
Andreas,
gets terminated.
well, Andreas, I got laid off the job. They was paying for it. How am I gonna pay for something now? I'm not even getting a paycheck anymore. So what do I do? Like I can't even afford that. So what the hell? Help me out, bro. What do I do?
Preparation, right? That means
Right,
that person wasn't prepared,
Yeah.
right?
And to that point, and thank you for mentioning that. And to that point, ladies and gentlemen, you have to realize that when an employer, see, people complain about how much money they make at a job that's providing these kind of benefits, right? They would say, "Well, I'm only making $57,000 a year. I'm in poverty. Oh my God, I can't afford my own cell phone." And it's like, yeah, but you get health benefits, right? Yeah, I get health benefits. Yeah, I got a 401k. And it's like, okay, you're paying into your 401k. Your job is covering your healthcare benefits. how much is that healthcare package? No one ever could give you an answer as to how much their employer is paying into their healthcare package, which to your point, Andreas, it could be upwards to $40,000. So if you translate that money, if you said, hey, employer, I don't need your healthcare package, give me the money that you would have paid into my healthcare plan, put that into my salary, and I will get my own healthcare. Employers would jump on that in a heartbeat. They'd be like, hell yeah, because they're not
Exactly.
getting they're not getting, they don't have to worry about that. They don't have to worry about the taxes. They don't have to worry about any of that headache. So they would
Mhm.
jump on that. Ladies and gentlemen, if you don't know that you could do that, I just taught you something tonight, and Andreas is confirming it because as somebody that's retired, and is drawing a pension and has healthcare for life, I could go out and get a job and say the starting salary is $50,000, $70,000. I can easily increase that by just saying, hey, this job comes with benefits package, right? I don't need any of your benefits. Roll up that cost and put it into my salary. They would jump on that. They'd be like, oh, cool, yeah, no problem, no worries. Talk to us about
Yeah.
the pros and cons of doing that. So would it be economically smart for a person who may not even be in that situation, but they say, hey, instead of me my employer paying for my healthcare package, I go out and shop around and get my own. Is there a pro and con to that?
Um, Normally, if the employer offers it, you're gonna pay way less than what you're gonna pay on the private sector.
Okay.
It's very expensive.
Yeah.
There is no subsidies. There is not, that there is no pooling. You're the pool. Insurance is, remember, insurance is pooling, right? X amount of people participate.
Right.
That reduces costs, pays
Exactly.
claims. So if you're just by yourself, you're the risk. So that
Yeah.
Right.
from the math perspective. So there is what is it called, the ACL, the Affordable Care Act. That's when it comes into place for people the ones that didn't have insurance to have insurance. Okay, but again, that's when it comes from taxpayer money. Now they're saying they give you credit, they give you money to have X, Y, and Z healthcare per se. But at the end of the year, based on your income, you might either keep that or you have to pay that back. And a lot of things, what happens is that people were making way more money than what they actually say that they were making. So they were getting those credits, and at the end, they were losing their credits. They had to pay the money back. I mean, it was like crazy because you just gotta say it. You don't have to pay it. And again, when things get too much government rundown, we just saw an example with Medicare. It opens the door for abuse.
Yeah.
It also causes healthcare to increase because it's less competition, right? It's more competition in the sense of like who can take more, not who does a better job at.
Yeah.
That's
Right.
the key when it comes to the healthcare market, right? So letting companies, in the case of healthcare market, letting healthcare companies compete for the consumer on premium. In order for them to compete, they're gonna have to what? Lower some of the prices,
cost.
renegotiate contracts
Exactly.
with doctor, right? But it comes down to who's getting the money. Getting the money is the
Right.
doctors. So
Mm-hmm.
I'm not saying doctors. I mean the medical world, right?
Yeah.
Nurses,
Right.
and
The
you know what?
medical.
Everything you go to school, you should get paid fairly, right? You should be paid fairly for what you do, and it's worth it, right? That's what is the great thing about America. They compensate people taking risk, being entrepreneurs.
Right.
Um, but too much contributions from the government, too much government intervention on programs, I don't think is healthy for any sector.
Yeah. I got a question for you.
So,
on that.
yeah, and I have a
Yes.
question after that because
Okay.
mine is going to be on long-term health
Okay.
or
And
long-term
long-term
care.
care, okay.
Mine is more
Okay.
tied to this piece here. The idea of getting health insurance from the marketplace, right?
Hmm.
and you're paying more because you're talking about individual, but by individual risk, right? So going out, would it be beneficial for the person to say, you know what? Let me find. I don't know if this is this, but they said let me find a company that does grouping in health insurance where I can pay lower costs. Would that be a benefit to get into if it exists, or would it be better for them as far as coverage goes to go with that singular plan?
Well, usually to call it group insurance, it has to be at least minimum two people, not in the same household, that are applying for it.
So I can knock on my
So
next door
you
neighbor.
can,
I can knock on my next door's neighbor door and say, "Hey, bro, hey, let's get some insurance together." Would it be
correct, you
right?
can't.
Oh,
You
damn!
can't.
See, man, you be
You
busting my
can,
bubble,
correct.
man. Come
S-
on.
you try.
I try to
But
scam.
you can go on ACA,
Yeah,
right?
yeah,
You can go on ACA and apply for the Code for Care Act and see if it works.
Hmm.
Like for example, when I started my company, right? I had the option to pick up Cobra, which it was like $1,800 a month, or pick up ACA,
yeah.
right? Which it was like $450 a month, $500 a month, and I was like, okay. Then I compared the benefits, and I was like, you know what? It's better off. I set up my own group insurance in my office, even though it's two of us, right? We pay for it. We pay more,
Yeah.
but we have way more benefits, and we all. Not only that, we the price of the true cost ends up being lower the ACA, and we have the option to have, as I mentioned last week, that having that HSA, which to me that was the kicker.
Yeah,
That
the
was the key.
HSA is a good one. Yes, yes, absolutely.
Correct. So
And
So,
every
ladies,
situation is different.
yeah, ladies and gentlemen, for those that are listening today, tonight, or watching, we talked about HSAs last week. So once again, go back to last week's show, and you can pick up on how we what we covered on that. Tiff, go ahead with your question, ma'am.
so mine has to do with long-term care, and that's going to be a thing, right? That people obtain long-term care insurance.
Yeah.
So some people believe that long-term care is provided by Medicare, the Medicare program, when in fact, Medicare is a short-term program. It's not a
Correct.
long-term care program. So can
Correct.
you give us, some options for long-term care, where they should go to get it, and just the understanding between short-term and long-term care?
Sure, absolutely. So, by the way, that's a great question, Tiffany. So, long-term care is not covered by Medicare. Okay, long-term care or custodial care is when somebody cannot do or perform two of the six activities of daily living: eating, bathing, dressing, toileting, transferring, things like that. So, you cannot do two of those things, or a cognitive impairment like dementia, Alzheimer's, right? That triggers long-term care. And in fact, yes, Medicare does not cover on the long run. There is something on the Medicare Part A called a skilled nursing care. What that
Mm-hmm.
means is they might cover from day one. For the first 20 days, Medicare absorbs the bill 100%. From day 21 to 100, there is a daily copay. I don't know, it's like 190, $200 a day, right? For those
Mm-hmm.
100 days. But you have to show improvement. The
Mm.
average stay somebody's on that situation is around 19 to 23 days. That's the average. They know the
Mm-hmm.
moment you plateau or you're not getting better, Medicare cuts it. They say you're done. Go home or go to the nursing home.
Mm-hmm.
When Medicare
Exactly.
stopped, the supplement is not covered either because Medicare is stopped. Medicare is Big Daddy now.
Mm.
So at that moment, what it kicks in is your assets. What do you have? That's the question that they ask when somebody goes to those facilities. What do you have? Right? How are you gonna pay for it?
Yeah.
So that's why
Right.
long-term care is so important. Now, short-term care is that the care is expected for to last between 90 days, but not more than a year. And
Mm.
long-term care, that the care is expected to last more than 90 days and not less than a year. So, just to give an example, Miss Betty falls on the street, breaks her hip, gets surgery. She will not qualify for long-term care because if that surgery is got done properly, in less than 3 months, she should be okay. So long-term care will not pay for that. That's why
Mm-hmm.
somebody needs short-term care. Now,
Mm-hmm.
somebody had three massive strokes and is 50% paralyzed. That person is going to need long-term care because it's not getting better.
Mm-hmm.
Yeah.
Right.
You know? And that's when that kicks in. Um, Usually, you want to acquire that in the private market. In fact, if you look at your social security statements, I mean, they used to send it on papers, now it's digital. But
Mm-hmm.
if you go in, there is a section there that says get you on long-term care because Medicare, Social Security will not pay for that. The government are already letting you know they are not covering that for you.
Mm-hmm.
Mm-hmm.
So it's the private sector. And
Right.
I wish I could say there is a lot of companies that they want to offer it, not that many. The market has shrunk a lot, and it's because it's a bad business for the insurance companies, which is a big reminder. The one thing that scares the insurance company the most is that thing that you should pay the most attention to,
Mm-hmm.
right?
Yes, I
Um,
I believe.
yeah, and just figures, right? The
Mm-hmm.
average person, when somebody turns 65, 70% of people turning 65 are going to need that type of care. So think about, Randy,
Mm-hmm.
when you turn 65, right? Seven out of your 10 friends, including yourself, are going to go to a nursing home, whether we like it or not. That's the number. Now,
Wow.
if there is a couple, that number goes from 70 to 93%.
Mm.
Somebody's going to need the care. And that's due to the advances on technology, right? People are living longer. Living longer doesn't mean that we are living better per se,
Right.
or that the body doesn't deteriorate. The mind might still there, but the body gets fragile. And
Mm-hmm.
curiosity, that care, for me in particular, when I see with my clients, my number one goal is to protect the spouse, the wife, the female, because they outlive men. Most nursing homes are full with women, no men.
That's so true.
They have a longer lifespan. So they're the ones who need it most. You
Mm-hmm.
know, Right? We're guys, right? We die. That's what we
Yeah,
do.
there's a, I'm laughing. I'm laughing. I'm trying to tame myself because there's a comedian that was back in the 80s. It was this was back in the 80s. It was a skit that he did. He talked about how men, how women outlived the men, the husbands, and he would open up the newspaper and read the obituaries, and it will always close with he survived by his wife every single one.
Yeah.
So I was just laughing
Yeah.
about that. But you're right. You're absolutely
Yeah.
right. You're absolutely right. But
So,
guys, go ahead, finish
uh-huh.
your thought. Go ahead, finish your thought.
so what, because long-term care, I think, is out of the whole conversation that we had today, that's probably the biggest thing that people need to take on. People talk about
Yeah.
Medicare, Medicare supplements, Medicare Advantage plan. I'm sorry we didn't touch back on that. I can go back later on that. But that's just a portion of the bill.
Yeah.
When it comes to long-term care, you are footing 100% of the bill.
Mm-hmm. Yes.
It's scary part,
Yes.
right? That's the number one reason why seniors go bankrupt. It's not because that they failed to save. It's because they failed to plan. They didn't plan to
Exactly.
fail. They failed to plan, right?
Mm-hmm.
And healthcare, and especially when it comes to that, is the number one or the biggest expense when it comes to healthcare related. So yes, Stephanie, having a plan is important. If you're in the mid 40s, or probably the earlier you start, probably the less money you're
Yeah.
gonna pay, uh, because the premiums get
True.
very expensive I mean, I can tell you, it gets in the thousands of dollars if people
Yeah.
wait.
It does.
But not
Yes,
only
the older
that,
you get.
so money is one thing, right? It gets expensive, but the other part is it gets really hard to qualify. So I have a lot of people that they
Mm-hmm.
want it, but they can't get it.
Mm.
It's already too late.
Yeah.
So people need to get in before before it's too late, before conditions develop that pushes insurance companies to say no, right? When the risk becomes too
Mm-hmm.
high. And also the options where people want care. Some people don't mind going to a facility. Most people prefer to stay at home. Well, there's a lot of
Exactly.
plans out there that they can provide that care at home as long as possible.
Yeah.
Knowing the limitations, but understanding that, at the end of the day, it comes to dignity, right? How you want to
Yeah.
be remembered, how you want to keep your independence. That's the bottom line. And most people are unaware of it. They
Hmm.
expecting the government to foot that bill, which, if you are Medicaid, welfare, yes, Medicaid will pay for that. But
Mm.
Mm-hmm.
you have to deplete all your assets. I mean, we can have another show about that. That's a
Yeah.
whole
There's a
different
whole
animal,
nother. Yeah.
right?
I was gonna say.
I
That's a
know.
Right.
whole
I
So you're
mean,
right
different.
there's
about that.
so
Yeah.
much.
So it is a lot.
There's
Ladies and
so much
gentlemen.
to cover.
Yeah, ladies and
I
gentlemen, I
know,
hope you
I
all
know.
are getting something out of this tonight because it is a lot. It's understanding the differences between the plans, understanding where you qualify, understanding what situation category you fall under, and all of that. There's so much, and people. Unfortunately, we are in the age where we run to TikTok and Facebook to get our information versus picking up the damn book
Mhm.
or going directly to the source of the website and
Mm-hmm.
reading the information for ourselves and saying, okay, this is what this is what that is, versus, hi, hey, welcome to TikTok, and I'm gonna tell you about Medicare. You like,
That's true.
so,
Facts.
but hey,
That's
folks,
facts.
this is awesome. Tell Andreas your final thoughts, and then Tiffany.
Um, yeah, sure. Just I want to cover one thing that we forgot. It was the
Sure.
Medicare Advantage plan,
Yeah, yeah, yeah.
right?
Oh, yeah, yeah.
So Medicare Advantage, which is very popular, what it is, which is Part C, like Charlie, is the private sector of Medicare. So Medicare transfer, right, that risk to private insurance companies. So let's say, Randy, you become eligible to Medicare. You have the option to have Medicare Prime as a primary and pay for a Medicare supplement for insurance co-insurance, right? Uh, Medicare Part B costs $206. A supplement might cost you, I don't know, 150, 160. So
Mm-hmm.
$360 plus Part B, call it 400, right, a month.
Yeah.
Now, in exchange, you can go to a private sector, have some type of HMO or PPO, similar to like where we're working, kind of benefits.
Mm-hmm.
Mm-hmm.
You with me? You have a primary doctor, a specialist, right? You might pay copays to see some doctors. You might have an out-of-pocket maximum. You know that there is a max that you can spend on the year.
Yeah.
Mm-hmm.
Depending on the state. For example, here in Nevada can be from $1,000 to 6,700, right?
Woo.
California,
Some shit.
7,200 maximum for the year, correct? Now,
Mm-hmm.
but you know that it's the maximum that you can spend in healthcare. God
Mm-hmm.
forbid something happens for that year. Now, in addition to that, they throw some perks. Perks like they cover dental. Medicare doesn't cover dental. They your
Mm-hmm.
eyeglasses. They even pay for the gym. Most of these companies, right? It's very attractive.
Mm-hmm.
They have a lot of add-ons and a lot of goodies, but they become your
Mm-hmm.
primary care. Medicare does not work. Medicare say, I transfer the risk to Tiffani. Tiffany, you take care of Randy. I have nothing to do with him. Okay? That's exactly how it works. Now,
Right.
in
Yeah.
exchange, Tiffany, here, I give you $10,000. That's your bonus. You manage his care. Plus, whatever premium he's paying me, the $200 a month, I'm going to transfer that to you. Now you manage his care. With those
Mm-hmm.
12,
Mm.
12, $13,000 a year, you have to take care for Randy.
Yeah.
So you have
Yeah.
to pretty much work that up. And there is obviously a table that is a base, a standard healthcare structure built by Medicare that all these insurance companies that want to participate, they had to build from there on. And then they compete, right? They give some goodies,
Right.
which like every year is a nightmare because all those benefits change every year from October 15th to
Yes.
December 7th. Whatever they have is changing because they get renegotiated. It's annoying, but that's part of the capital system.
Yes.
I don't know that explains it. And that's again, that's it can be an HMO, it can be PPOs, right? They're different types.
Right.
But that
Exactly.
basically are the primary care. In exchange, I'm not paying a premium.
Right.
So my premium is zero. But remember, in America, nothing is free. It's not zero. It's because what I pay to
Right.
Medicare
Exactly.
goes
It's on the
around.
back end, right?
Yep.
My money that I've been paid to the
Exactly.
government goes around. That's
Yes.
how it works.
Yes.
Got it.
So that is
Dre,
wonderful, Andreas.
yes, thank you so much for that. Dre, tell
You're
people how
welcome.
they can follow you, support you, and get your services and all that good stuff, sir. And any final thoughts you have.
Sure. Absolutely. Thank you. Thank you, Randy. Thank you,
Absolutely.
Tiffany. So, yeah, they can follow us goldenshieldfinancial.com. That's our website. They can contact us. Our office number is 702 825 3600. And also our email is contact us at goldenshieldfinancial.com. They can reach out to us, and we will be happy to assist anybody. We pretty much cover nationwide, so we had a team of experts. My team here, everyone when it comes to Medicare, they are all Medicare Master Certified, so that's important to know because
Mm.
there is less than 200 Medicare Master Certified. There are like a million people on Medicare agents, but very
Right.
few are Medicare Master Certified, so that's a plus.
Sweet, sweet. Thank you so much, Tiff. Final
Absolutely.
thoughts.
Well, my final thoughts are if you don't have someone like Golden Shield Financial, you should definitely, definitely look into getting someone like Golden Shield Financial or Golden Shield Financial themselves in terms of Medicare, understanding Medicare and the healthcare system. And not only that, when we talk about long-term care, that's going to be a big thing in the future. And that's part of the private sector. And like you said, Andreas, earlier, prepare yourself for that. Talk to somebody who can advise you the best way to go. And I know personally because Andreas is a very educated person. He has all the certifications. So why not give him a call and ask him about some of the things we've talked about or all the things that we've talked about. But yes, having a good advisor is key in understanding healthcare, Medicare, overall your financial options.
Absolutely, absolutely. Folks, say thank y'all so much. This was very educational. I learned so much tonight. Seriously, because I don't have to I don't I'm fortunate that I don't have to deal in that space. Being that I get my stuff through the VA, Veteran Affairs and stuff. So I don't pay attention to that stuff. My wife on the other hand, she deals with all that. She'll tell me, I'm like, what does the paper say? I'm lucky in that regard. But it's great. I know the audience they probably appreciate this as well. And thank you once again, Andreas, for bringing this wealth of knowledge. And with that being said, we'll pick this back up because we got more to cover. So
We have so much more to cover.
yeah. So I think next week should be good, and we'll see y'all then. So thank you all once again, and see y'all soon.
Thank you.
Thank you, guys. Take
Absolutely,
care.
absolutely. Yep,
Bye.
guys. Hey, phenomenal discussion tonight. And I truly enjoyed it. But yes, you gotta get into this stuff, folks. You gotta pay attention to it. And I would say this, pick up my book. I don't talk about Medicaid or Medicare in the book, but we do talk about the media and how they lie to you. So there you go. Polarizing America on shelves April 14th. And you can go ahead and pre-order now anywhere books are sold. And with that being said, folks, I am way over time and I am late to another thing that I was supposed to be doing. So with that being said, I will holler at you all later. God bless you. Be safe and take care and see y'all soon. Ciao, ciao. I hope you enjoyed today's program. You can follow, like, share, subscribe on Spotify, Substack, Rumble, YouTube, Facebook, and your news. And also you can download Let the Truth Be Told app on your favorite streaming platforms such as Fire Stick, Apple TV, and Roku. Take care. God bless.